Hello, everybody. I'll give it a couple of minutes for our participants to get settled. Welcome one and all. Thank you again for joining the Catholic Impact Investing Collaborative's October Community Forum, focused on addressing health inequities through impact investing. For those that don't know me, my name is Maggie Stoller, and I serve as the Associate Director at the Catholic Impact Investing Collaborative, also known as CIIC. We're really thrilled to welcome so many of you today, and I wanted to thank you each for joining. So before we get started, we typically like to begin our community forum events with an opening prayer. So if you could all join me, let's start with just a brief moment of silence to take a few seconds to place what we carry in our hearts, the burdens and the joys, in the hands of God. So for our prayer today, I am going to be sharing an adapted version of the Prayer for the Sick, which comes to us from the Catholic Healthcare Association of the United States. So we pray, ever living and ever loving Lord God, tend your sick ones, loving Lord, rest your weary ones, bless your dying ones, soothe your suffering ones, pity your afflicted ones, shield your joyous ones. Give strength and vigilant awareness for all of your caregivers. Jesus showed his love for the sick by visiting them, by touching them, by forgiving them, and by healing them. Jesus encourages us to recognize him in our sick brothers and sisters. May the example of Christ guide us in showing compassion for the sick, for the suffering, and for the infirm. Help us to understand those that we come to serve and reach out in love to them. Bless our caregivers with patience, mercy, and compassion. Inspire them with insight to minister to all people with loving kindness. May they be your compassionate presence and share the peace of your Holy Spirit with everyone they meet. We ask this through Christ our Lord. Amen. Always have the Holy Spirit. Well, thank you all for joining me in that prayer. I'll just share a bit about the work that we do at CIIC, and then some housekeeping tips for the webinar today, and then we'll turn it over to our webinar facilitator. So for those that don't know, the Catholic Impact Investing Collaborative is the convener of a network of investors that want to accelerate the needed transformation towards a solidarity economy at the service of people and planet. So here at CIIC, we have a trusted impact investing community where learnings lead to action and allocating more capital for a just and equitable world. We offer membership to Catholic asset owners with access to a dedicated private community platform, a deal sharing dashboard, and pitch sessions with peer recommended and vetted investing opportunities. We also offer the Catholic Impact Investing Pledge to encourage Catholic organizations to move beyond avoiding harmful investments and to proactively make commitments to measurable impact investments. So I'd like to just cover a few housekeeping items today. So for our attendees, we encourage you to use the chat box below to introduce yourselves. Let us know where you're joining from, and feel free to use that to interact with each other and with our speakers. If you do have any questions or comments for our speakers, we will be having a Q&A at the end of the hour today. So please make sure to drop those questions in the Q&A area at the bottom, and we will do our best to respond live to your questions or to follow up after the webinar. You can also upvote any questions that you'd like to see answered by our speakers by liking them. And just a reminder that this webinar is being recorded, and we will be sharing with you a link to that recording in the next day or so. So I am now very excited to introduce our webinar facilitator, Tara Kenny. Tara has had a multi-decade career as a portfolio manager, investing in emerging market equities for Scudder Investments and then for Deutsche Asset Management, and later worked with numerous Catholic organizations at a boutique firm specializing in ESG investing. She is currently overseeing a series of mutual funds as an independent trustee for Fidelity Investments, and she teaches a course at Notre Dame called Sustainable Accounting and Impact Investing. Tara also serves on the board of Catholic Charities USA, where she sits on the investment and audit committees. Please join me in welcoming Tara as our facilitator.
Thank you, Maggie, and welcome all to this afternoon's presentation. I feel honored to be your facilitator today, and we're going to be discussing a topic, I think, which will resonate with all of you here, which I'm sure you represent various parts of our country where the healthcare systems are truly in need and in demand to provide solutions to community impact investing. Impact and what you'll hear today, place-based investing strategies have long allowed the healthcare systems to earn a financial return on their investment portfolios while producing a positive social and environmental impact within their communities. We also know that hospitals and healthcare systems have significant untapped assets at their disposal to help address the challenges in these communities. This panel today will highlight some of the premier Catholic organizations that have incorporated into their mission statements and their investment portfolios these issues and how they've been able to address local healthcare inequities through their investments. We'll hear from two Catholic asset owners, one based in St. Louis, Dr. Alexander Garza with SSM Health, and Pablo Bravo with CommonSpirit Health based in San Francisco, as well as David Zuckerman with the Healthcare Anchor Network in Washington, D.C. Thank you all for joining us today. And I believe we have Pablo right there on the screen. Welcome, Pablo. Thank you. First, I'd like to introduce David Zuckerman from Washington, D.C., who is the president and founder of the Healthcare Anchor Network, which was launched in 2017. David is a national thought leader on the role of health systems as anchor institutions in building community wealth and an inclusive economic development. David is the co-author of numerous reports that have helped propel forward the anchor mission movement, including Hospitals Aligned for Healthy Communities Toolkit series. He previously served on the board of trustees for the Consumer Health Foundation from 2016 through 2021, including acting as treasurer. In this role, he led the expansion of their place-based impact investing strategy. Welcome, David.
Thank you. Welcome. Thank you for having me here, Tara. I'm just going to bring up my slides for this and really appreciate the opportunity to speak with you all. And a lot of my comments are going to echo some of the opening comments. And really, this is about how do we bring more resources to community to address the inequities we see in place. And our frame is that of the anchor mission, which I'll very briefly describe. But I really want to spend a lot of time just talking about how impact investing, and in particular, geographically targeted impact investment, fits into our framework and some examples of that around the country. So Healthcare Anchor Network's mission is to catalyze health systems to leverage individually and collectively their hiring, their purchasing, their investing, and other key institutional assets to create economically and racially equitable local economies that sustain healthy communities. And we do that through three ways primarily. One is raising the bar, and I'll talk a little bit about our efforts around leadership commitments in the space and helping set the standard for what best in class looks like. We also work actively with our 75 current members to accelerate adoption through a variety of ways of sharing, spaces, tools, et cetera. And then we bring folks together to foster collaboration where gaps exist. And so we predominantly do that through an action network. We produce a lot of case studies. So we have a number of case studies on health systems doing impact investing around the country. And then lastly, in a few cases, we provide advisory services to our members to go deeper. And at the end of the day, what we're trying to get at is how to drive social impact by fully activating our members' potential as a community asset. And we believe that impact investing, geographically targeted impact investing, is one of those key ways. Because as you can see from this slide, just from our 75 health systems, hold about 250 billion in investment assets. And even if we shift 1% of those resources back into community, that is an incredible amount of dollars that have the potential to start and sustain catalytic projects that address the inequities in place. Just very briefly, a little bit more about what we do. In terms of raising the bar around leadership commitments, I'll talk today specifically around our one in place-based investments. We have a number of different spaces that we create around accelerating adoption of anchor strategies. And then lastly, some of our other ways that we foster unique collaboration is that we work to standardize data collection. So I think we've created the first in the nation process for collecting data on health systems doing impact investing and really getting at a level of detail there and creating ability for health systems that are interested in the strategy to begin to benchmark. We've also done a lot of work around collective federal policy advocacy on affordable housing and workforce development. And of course, impact investing is really a key way that health systems can support affordable housing in their communities, but we also know that additional resources are needed. And then we bring together our members once a year to learn more deeply about this work, and we'll be having a track on just impact investing at our annual convening, which actually is going to take place next week in Detroit. So it comes back to this idea of fully activating healthcare as a community asset. And so I just wanted to paint the picture for folks that for us at the Healthcare Anchor Network, we focus on three core strategies of hiring, purchasing, investing. And then we've seen these other strategies materialize that really complement those core areas of how health systems can leverage their voice through policy advocacy, how they can think differently about their community giving, how they can think differently about their real estate footprint. And often that's an opportunity to align with impact investing to create projects in their community. And then lastly, how they can differently tap into their volunteers to build greater community capacity instead of traditional volunteer efforts. And so again, today I'm just going to talk about impact investing, but I wanted to paint this picture that our frame of the Anchor mission is really recognizing health systems' roles as significant economic engines that have a social mission that are rooted in place. And it creates an opportunity to look differently at the assets and resources they have and how they can be leveraged in the everyday act of serving their communities better. And so this conversation today around impact investing is actually one that's not new to Catholic healthcare. Catholic healthcare pioneered this work, and really I looked to Pablo and CommonSpirit Health at being at the forefront of this movement around impact investing over the last 20 years. But I think what I want to share with you, which is I think really exciting, is that partly through the efforts of the Healthcare Anchor Network and others in the sector, we've been able to move this conversation beyond Catholic healthcare to really being something that all health systems should consider as a tool for better impact in their communities. So what you see on this slide is a little bit of how you might think about the spectrum of investment that an organization can do. And on the left, you can draw a tangible line between the resource that the organization has and the impact in the community. And so most commonly, and Catholic healthcare has been really good at this over the years, it's been through grants. Increasingly, again, Catholic healthcare pioneered a lot of these efforts and starting to see other efforts in healthcare around this, around impact investments. And our frame around place-based investments is really how to make those impact investments geographically targeted to the service areas your organization serve. And so what we ask our members to consider is really designating a percentage of their investment portfolio for doing this activity, creating a carve out of their investment portfolio, because most of their investment portfolio is in traditional investing. And I think what you're also going to hear is that some of that investment portfolio that's in traditional investment, there's also been an effort to apply ESG screens, environmental, social, and governance screens. And that gets us to responsible investment. And so that's about bringing values alignment, doing no harm, but it's not always possible to get down into direct impacts in your community. And that's where I think the opportunity exists for place-based investing. And I think the opportunity now is even more important than ever. Healthcare is facing really difficult financial headwinds, and it's not going to be as easy to write grants for different activities in the community. And what's exciting about impact investing is it's a balance sheet play. These are dollars that your organization will continue to have and invest for the long-term solvency of your organization. And shifting 1-2% doesn't impact the balance sheet long-term, but really opens up a new resource that can be leveraged within community for greater impact. So within the Healthcare Anchor Network back in 2019, we helped work with our leading health systems to develop a pledge around impact investing. And we were able to put out this article the first time in Modern Healthcare, the first time that health systems have come together to acknowledge the tool of impact investment as a way to improve health and well-being collectively. And really exciting by the number of signatories that joined onto this. And a little bit of what this commitment asked institutions to consider was to allocate at least 1% or $50 million, whichever is less, of their long-term reserves towards geographically targeted impact investments, and then to deploy that over a 5-year period. And so what that meant was going through the process of creating an amendment to their investment policy to incorporate this carve out, and then taking the time to build the program and figure out how, in partnership with community, those dollars can be best deployed. And then we ask institutions to collect and submit data to HAN, the Healthcare Anchor Network, annually to track progress. And we've been able to begin to create benchmarking for the first time in the sector around this activity. These are the 13 systems. So you're going to hear from Pablo at CommonSpirit Health, and I see a bunch of familiar names on the call as well. And so just want to acknowledge those other Healthcare Anchor Network members that are both members, such as SSM Health, and also a few of the signatories that I see on the call. So we appreciate all of your support for HAN and engagement in this important work. So I just wanted to take a minute to go through a couple of quick examples, because I know you're going to hear more about these examples from the other speakers. But just one example is Intermountain Healthcare, which was one of the early non-Catholic health systems to make this commitment. And they allocated 2% of their investable assets, and then committed over the last 2 years, they've been able to actually shift $23 million into impact investments. And they've done it through a variety of ways. So most commonly, health systems work with an established intermediary, a community development financial institution. But we're also seeing a number of institutions say that doesn't always meet the needs of their communities. And they might do direct loans with local nonprofit or for-profit businesses. And they also might look at their community giving and say, can we make an investment around affordable housing, but also provide a grant around services? So some things can't be done with an investment, can only be done with a grant. If we align the two, can we have more impact? And I think that's the question that a lot of folks are exploring around this topic. One of the other systems that most recently made this commitment was University of Maryland Medical System. And so they're a smaller system than Intermountain. 1% of their portfolio is only about $14 million, but it's $14 million. And that is a tremendous amount of resources that we can put into communities. And so they, again, as their name implies, they prioritize the state of Maryland. They mostly worked with CDFIs. They actually were able to find some place-based private equity funds that they thought were mission aligned and actually didn't force them to sacrifice much in terms of return. And just to note a couple of those examples, one of them that I'm personally really excited about is Oberon Cooperative. So our lens, and I think this aligns a lot with efforts in Catholic social teaching and other efforts to support really place-based community development in the Catholic community, is around employee ownership and cooperative ownership. And so Oberon Cooperative actually identifies businesses where the owner is about to retire and helps transition those businesses to cooperative ownership. And that creates a wealth building opportunity, specifically in industries that are low wage work. So they've focused on home health care, they've focused on logistics. And for the most part, a lot of those businesses tend to have very diverse workforces where the ownership wasn't. And they have worked actually with Kaiser to target specific vendors within the supply chain to make that happen. And so I think this was a really creative opportunity, going back to the holistic anchor frame of how you can think about your supply chain, your investments, and also thinking about getting at this benefit of building wealth and for low-income communities and communities of color through these strategies. You can see a couple of the other things that they've supported, including a very targeted effort around Baltimore in terms of creating small business lending. And then, of course, the Reinvestment Fund is a very large CDFI that serves many communities across the country. The last example I want to give, because I feel like I should give a Catholic example, because many of this work started with Catholic healthcare, is Bon Secours Mercy Health. And why I want to highlight them in particular is because I think they've been pretty innovative in supporting other types of community wealth building strategies around affordable housing. So they've also allocated 1% of their investment portfolio, and over the last 10 years have deployed about $34 million towards these different focus areas. The one example that I just want to briefly talk about is the Maggie Walker Community Land Trust. And so Community Land Trust is a strategy to create permanently affordable housing. And this was an effort in Richmond, Virginia, where they recognized that where their hospital was the east end of Richmond was rapidly gentrifying. And they wanted to put a mechanism in place to help ensure that residents that have been there historically were able to continue to stay there. And so they looked at what their options were and were able to work locally to provide an investment and a grant to help create the Maggie Walker Community Land Trust. And that land trust actually links up with the land bank from the city in order to provide a way to funnel vacant land into this process. And so I think what's exciting about this work is that as you begin to peel back the layers of it, we can really take a systems approach to thinking how these different strategies can begin to connect for greater impact. So I know I just have one more minute, and I flew through these examples. I'm happy to go into them more deeply in the Q&A. But what I want to come back to is that this idea of fully activating healthcare as a community asset. It is a community asset, and we often think about the community giving components of it, or we think about its healthcare access, and all of those are critically important. But as the largest economic engine in our community, and as organizations that have to hold long-term investments, there is an opportunity to leverage the balance sheet more fully to drive impact in a new and powerful way. And I think it starts with simply asking the question, what are we doing with our investments? What would it mean to carve out 1% or 0.5% or some dollar amount to begin to work with partners in a different way around these type of place-based investments? So with that, thanks again for inviting me to be here with you all today, and I'll pass it back to our facilitator, Tara.
Thank you, David, for this truly important work and for helping us frame our discussion today. Next, I'd like to turn to our second speaker, Dr. Alexander Garza. As the Chief Community Health Officer at SSM Health based in St. Louis, Dr. Garza is responsible for deepening SSM Health's focus on the social determinants of health, equity, and social justice, as well as supporting the work of SSM Health's transition to population health. Dr. Garza has decades of experience in the public health arena, in safety and in policy development. He organized and led SSM Health's overall response to the COVID-19 pandemic and was recognized as a leader in the hospital for this good work. He later became the Chief Community Health Officer in August 2020, after serving as the Chief Medical Officer since 2018, overseeing the quality, patient safety, and clinical analytics of SSM. Welcome, Dr. Garza. Thank you for being here today.
Thanks, Tara, and thanks for the invitation. So just like David, I'm going to share my screen, and David will see some familiar themes here in what I'm going to present. I did want to make one thing clear. SSM is at the very beginning of our impact investing journey. So as Tara mentioned, I started this role around 2 years ago. It's a bit of a misnomer. So I was also leading the pandemic task force for the local area here. And then I'm in the military, and I got deployed to Kuwait as well during that period of time. So I like to give myself a little bit of breathing room and say we really started this work in community health really at the beginning of this year. So with that as a backdrop, let me walk through these slides really quickly in the interest of time. Just a little bit of background about SSM Health, Catholic healthcare organization based in St. Louis, but we're located across the Midwest in Wisconsin, Oklahoma, St. Louis, and Jefferson City, which is in the middle of Missouri, and then in Southern Illinois. And my reason for telling you that is each of those different markets that we're in are very different. So St. Louis, very urban dense, Wisconsin, much more rural. We have critical access hospitals there, and we're a little bit more spread out. Oklahoma is sort of a mix of those two, and then Southern Illinois, mostly rural market there. And which is important because when you're thinking about how am I going to be developing an investment strategy that meets the needs of all of my markets, it becomes a little bit more complex if you're just focusing on a single metropolitan area. So just using that as a backdrop. So like I said, we don't have, I'm not here to tell you like, hey, this is what we're doing investments in because we're just starting that journey. But what I wanted to share was just how we arrived at the process that we're using for an investment strategy. And so just a little bit of background. I'm sure this is all very familiar to everybody on this program. You know, the majority of health is dictated by things outside of the four walls of the hospital, and sometimes it's a little difficult for our caretakers to understand. But recognizing that the good work that they do and all of the important things that they do still are limited in the amount that it plays into the health of an individual and to that of a community. And so that was the whole reason for the development of this office. These are just a few statistics to share with you on why this is an important issue. Here in St. Louis, if you just travel 8 miles between two different zip codes, there's 18 years of discrepancy in longevity between the populations that live in those two different zip codes. That's a stark reminder of some of the health disparities within this urban area. $2,300 spent per capita on housing instability, and then over $150 billion in annual costs to the U.S. healthcare system due to food insecurity. So even if you didn't want to make it on a moral argument, there's an economic argument as well on why we should be doing these things. So this is important to us. We know that in order to achieve health, and there's a difference between, you know, healthy outcomes from the delivery of healthcare and the global health of the community. There's a difference. Reducing the inequities in our healthcare outcomes as well, so things that we do control. And then this will ultimately lead to lower unnecessary and avoidable care and show commitment to our community. And this is one of our 4 pillars in our strategic approach for the next 5 years is community health. So how do we do that? So what we're focusing on is 3 different primary focus areas. And the one that's most relevant to this discussion is our first dot point, which is transforming communities through policy, system, and environmental change. And the way that we describe it is this sort of a layered approach. And so you have to start at the very strategic level. What is driving poor health overall for the community? And that's that first one. Then assessing and addressing inequities in health outcomes. That's really within our clinics, within our hospitals. We can understand and develop programs and reduce barriers for clinical inequities. And then there's this sort of middle area, which is how do we address social determinants that lead to poor health outcomes? And so that's sort of the bridge in between. Most related to this discussion is our first strategic objective, which is transforming communities. So as David mentioned, we are a member of the Healthcare Anchor Network. And we work in various ways through the national as well as through our local partners. And that's the objectives are to improve health equity by reducing inequity at the community level. And this takes broad efforts. So not just focusing on the investment, but as David mentioned at the beginning of his presentation, but also on hiring and spending as well. And this has to be done with our community partners. And so you'll recognize some familiar themes here. Impact hiring, impact purchasing, and impact investing are the 3 different buckets that we're focusing on at the community level. And so one of the unique ways here in St. Louis that we're going about doing that is in addition to belonging to the National Healthcare Anchor Network, the St. Louis metropolitan area as one region within our system has developed its own sort of local anchor network as well. And it's called the St. Louis Action Anchor Anchor Action Network. It's kind of a mouthful, but it brings together the major healthcare organizations within St. Louis. So SSM Health, Mercy Health, and Barnes Jewish Christian, BJC Health. But in addition to that, it also has brought together the Institutes of Higher Learning. So Washington University in St. Louis University, and the University of Missouri St. Louis, as well as some corporate partners such as AG Edwards, where we've all come together, including the Federal Reserve, to say, where is the most amount of need? And as David mentioned, geographically locating where is the most amount of need, which is in St. Louis, is North City and North County. And each of us making a pledge, it's like a reflection of what's happening at the national level, to say we're going to be hiring a certain amount, spending a certain amount, and then investing a certain amount in these zip codes, because we know if we can improve the economic output of this community, that it improves the entire metropolitan area. And for us in healthcare, we know that it improves their health as well. Now, it's a long-term horizon, so we're not expecting to accomplish this overnight, but the goal being it has to be sustainable investment, long-term outcomes. So I'm not going to spend a whole lot of time on the rest of this slide, and I'll briefly walk through the other two. So as I said, our second objective was really clinical outcomes, so looking at some of those inequities. And the way that we do this is looking at our clinical outcomes and using a lot of data and analytics to understand where are we seeing the worst outcomes. So for example, one of our long-term goals is to reduce the discrepancy in colorectal cancer screening amongst our different populations. We noticed that there was a difference in screening rates between our privately insured and those that were either underinsured or uninsured. And once you put focus to it and you say, this is what we're going to be doing, the clinics and the hospitals then are tasked with figure out how we're going to meet this goal to close that gap. And there's a remarkable, very simple things that we can do in order to decrease these gaps. And then strategic focus number 3, and so this ties in as well to the investment strategy, is to mitigate the adverse conditions of unmet needs of the individuals, specifically about social determinants. And so those can be anything from food insecurity, housing insecurity, transportation issues, any of a number of things that everybody is familiar with. So a lot of that is put into play by simply asking the questions, what is impacting your life, mostly outside of the delivery of healthcare, meaning those social determinants. I think, as everybody knows, CMS has already promulgated a rule for healthcare systems to begin screening for this. The Joint Commission has also implemented standards. And so we're on our journey of beginning to do this across our entire system on the acute side, and layering this into populations on the ambulatory side as well. But just getting back really quickly to the anchor network strategy. So these slides were developed by our investment team to help introduce the topic, and we're going through our discernment right now on amount and what to invest in. As I said, we're in multiple different geographies, so making sure that we're meeting the needs of our individual communities, as well as being very specific about what are the themes that we want to invest in as well. And so this is in alignment with the UN Sustainable Development Goals, or the SDGs. And so again, it's very familiar themes that I think everyone has seen before. And of course, these line up with social determinants as well. And so if you think about the things that we're screening for, it lines up with those UN goals as well. And so this is then what we'll be focusing on. And as David mentioned, there's multiple different vehicles that you can use to go about doing that. And so these are a few of the examples that we're pitching to our internal team to say, this is some of the things that we can be doing, whether it's through CDFIs, through community banks, investment managers, or project financing. And then some of the examples below, some of them of which David had already mentioned. We are making a big push in 2023 on food security, and so that's taken on special importance for us throughout our system. and it's in alignment with the recent White House announcement for food, nutrition, and health. And then, so this is the work that we're going through right now with both our system team and our regional teams, is determining and recommending a focus area. How is that tied to what we believe are our key performance indicators, evaluating the opportunities, which of course is the finance team, and then recommending budgets, and then ongoing investment monitoring and reporting back to our committees. We do have broad backing of the board, which is very important. And this is an important issue within our senior leadership team as well. And so we believe if we do all of this stuff, will lead to here: decreased disparities, health systems recognized as trusted partners, improved overall health status of the communities, which is highly important, and then decrease those social determinants. So let me end there and escape out of there and hand this back over to you, Tara.
Truly impressive work, and you're not only aligned with the SDGs, but you're very much aligned with the words of Laudato Si and Pope Francis. So thank you for being so true to that mission. I'd like to next introduce our last speaker, Pablo Brava, Dr. Pablo Brava from San Francisco, who is the System Vice President for Community Health at CommonSpirit in San Francisco. He's been with CommonSpirit Health for 18 years. During this time, Dr. Bravo has grown the community investment program from 35 million to over 400 million, and has expanded the grants program to include a new social innovation partnership grants program, aligned and integrated community health with its operations, innovations, philanthropy, care coordination, case management, emergency department, and population health management. We're really looking forward to hearing how you did all that, Pablo. His vision for community health includes expanding CommonSpirit's community partnerships, which is the way to address health and equity in low-income communities. Welcome, Pablo. Thank you very much for joining us today.
Thank you, Tara, and thank you for having me join today and share some of the work that we do. I think David Zuckerman wrote all that stuff up because he's such a good guy, but I wouldn't believe half of what he wrote. I'm gonna try. Can I share my screen?
Sure, go ahead.
Okay. Let's see if this works. There it is. Can you see that? Great. Okay. So I'm gonna skip a few slides because I think David captured the anchor work. I couldn't follow David on the communicating the anchor work, but it's everything that he described is actually we're doing. And then I'm gonna skip a couple of slides because I think Dr. Garza explained in detail about the social determinants of health and on the equity. So I'm going to dive in a little bit more just on the investment piece. This is a tool that is embedded into community health as a way to address what Dr. Garza was talking about, the social determinants of health, and equities around the zip codes, etc. But before I start going deeper into the actual program, I want to share with you how the program actually began. When the well, I'm going to explain a little bit more about CommonSpirit first to start. So CommonSpirit came about 2.5 years ago, by the combining of two organizations, Catholic Health Initiatives and Dignity Health, and now it's under CommonSpirit. Both of these organizations had embedded into their investment program a community investment allocation. So when the sisters created these healthcare systems, and they developed the policies, the investment policy that they created was like a three-legged stool. And the three-legged stool consisted of portfolio managers, and as a way to There's 3 areas of focus there. There's the self-insurance, there's the retirement plan, employee retirement plans, and then what we call the general bucket where we use the funds that we use to the funded depreciation that we use to, replace equipment, etc. The other leg of the stool is shareholder advocacy, which is really important for us to advocate for some of the issues that we deal with every day, whether it's housing, access to care, etc. And the third stool, the leg of the stool, was what we call community investing. The sisters felt that it was they felt very strongly that there was a need to invest in the communities that we serve. We currently serve over 140 communities, and the communities are reflective on where we have a hospital or facility and within the 21 states that we serve. The sisters felt strongly that a percentage of the allocation of the assets, of the unrestricted assets, be allocated towards this program. Currently, it's 400 million. It's significant, of which we have over 200 million actually deployed or in projects. Once the community investment policy was created and this program was created, then there was the program needed to have some structure. The sisters felt that this program should provide low interest loans, guarantees, and other types of investments within the guidelines. The program is to currently provides investment capital for up to 15 years for housing projects, 7 years for new market tax credits, and then 5 years and 2 years for lines of credits. The interest rate charged on the program is between 0 and 5%. The guidelines calls for the program to keep the 3-year average CPI. Granted, this year has not been a great year for us, for the reason being that inflation has really taken off, and our CPI is significantly higher than what we're carrying in the portfolio. But we're okay with that discrepancies for the time being. The program really has been focused on trying to make these low interest loans in the communities that we serve. And the way we structure these is by actually being in the communities and identifying projects that the community has a deep interest in. We have a community health director at each individual one of our facilities and our markets, and they're very much engaged in this work of potentially identifying the community's needs and identifying potential projects. We currently have, again, a portfolio of approximately over 200 million. We have 293 million actually approved. The difference between what's been deployed and approved is basically, the legal process takes a little longer. The loan size are ranged between 50 million to 5 million, but we currently are looking at the guidelines and adjusting the guidelines to increase the 5 million up to 10 million per project. We felt that the sisters feel like we could go to 50,000 because there are significant projects in the communities that don't have access to traditional lenders, and that we can provide capital for those more difficult projects. Again, the long term is up to 15 years for housing, 7 years for new market. And through the funded depreciation is how we allocate funds to this program. These are the types of loans that we make. We make direct loans. That means that we actually have a conversation with a nonprofit organization as to the need, and we actually make that loan to that nonprofit. Intermediary investments. This is investments through what we call a community development financial institutions. This is a way for us to leverage our money and extend our reach. We provide lines of credits. There's a significant number of organizations that we work with locally that depend on government or foundation dollars, and that can create an erratic cash flow. So we have provided and we continue to provide line of credit. Link deposit. This was a way the sisters thought of fighting predatory lending by making investments in credit unions and local credit unions and also local community banks. Equity capital, we've done this mostly to support community banks by purchasing some of their shares. And then guarantees. We provided guarantees for organizations that have not been able to access loans without having a cosigner per se. Actually, one of our first guarantees was to Mercy Housing on their first project. And now Mercy Housing can pretty much provide us with a guarantee. Currently, the portfolio is broken up into several different sectors. And the sectors are access to capital. That means by providing capital to CDFIs and banks. Affordable and transitional housing. And here we look at housing with a complete continuum from recuperative care to permanent supportive housing to home ownership. So we look at the whole continuum. Healthcare facilities, we have done quite a few investments in federally qualified healthcare centers. We also have provided capital for clinics that want to convert to federally qualified healthcare centers, and this is mostly working capital. Arts education. We work with CDFIs, community development financial institutions, to provide small business lending. Food, we look at the whole spectrum of food, from the production, distribution, and wholesale. And then the environment is definitely an area that we are currently very invested in, and it continues to grow, from solar all the way to water and other. So just to give you some impact by numbers, on fiscal year 2022, we did 8 loans. We normally do about an average of 4 loans per quarter. And that's because the loans are approved by the investment committee of the board. So we had 8 loans dispersed that we approved 17 million. We leveraged 43 million. What we mean by leverage means that for every $1, there was an additional amount provided. So by other funding. Housing was made $9 million went towards housing to create 458 units of housing that leveraged 24 million. We did one healthcare center at 5 million, which increased the people served to 23,000. That's an additional 9,000 square feet of clinic space. Geographic areas, we currently, just last year, we did about 3.2 million in California, 5 million in Kentucky, 3 million in Ohio, 2 million in Texas, and 3 million in Washington State. But if you look at the graph on the right side, we have a significant footprint in California and about 49%. The next would be Arizona, and then followed by the other states. We continue to look for areas that we have not invested in since the since we aligned and grew to 21 states, 140 facilities. And it slowed us down. The COVID slowed us down quite a bit. And that's it for me. If you have any questions, I'd be glad to answer.
Exactly, that's it, because this is truly groundbreaking and pioneering work over the better part of 2 decades, Pablo. So thank you for your leadership in this space. As a reminder, we're going to ask you to please post any further questions in the chat box, and we will try to pick them up here. And certainly we will get back to you if there's not time today for our panelists to address your questions and concerns, so that we can continue to be a resource for you. So thank you all. I suppose as a first question, I'd like to kind of ask the 3 of you, in the wake of George Floyd that happened right before, during the pandemic, there have been a lot of changes in your communities and a lot of outcries for addressing the unmet needs. Maybe you can share with us how your programs have adapted, how investing in addressing these inequities has improved the health of your communities. And if you can, work in a little bit of metrics, as Pablo has done in sharing with us. And I'm not sure who's brave enough to take this first.
Go ahead.
Yeah, so maybe I'll just answer that very broadly, Tara, which is, you know, from the events in 2020, and if you remember in St. Louis, it was even sooner than that with the Michael Brown shooting. And so there was, I think, always a realization of the undercurrent of you know, inequity issues within the community. But I think because of those events, both the pandemic as well as George Floyd, it really sort of was a springboard for more people to recognize this and to take action. And certainly I would say so within our healthcare system as well. But getting back to sort of the broader point, which I think David and Pablo were emphasizing, is that, you know, health doesn't start and end in the healthcare system. It has to be partnerships with people in the community. So, you know, at its core, it's really about economic equity and financial equity, amongst various other things. But and so that cannot just be solved by the healthcare systems, but we can certainly use our efforts to focus on those upstream issues that we know impact health outcomes down the road. Or as I tell our people, we can't achieve health equity until we achieve equity overall. And so that's those are just some general thoughts. The metrics are a little bit more challenging. I think they are, because, you know, you really want to be measuring community metrics, you know, whether that's poverty or median household income or percentage of people that own their homes, things like that. And then the broad sort of health outcomes are also challenging as well, because those are difficult to turn around over a short period of time. So we have a huge issue with maternal and infant mortality. You know, if you're Black, you're many times a greater risk for that. And the root of those are not, I mean, some of it, I won't completely say, you know, healthcare has nothing to do with that. We do, and we're working on that. But a majority of the issues are outside of the 4 walls. So let me stop there.
So for us in community health, we always go back to the roots of the sisters. So I think the sisters have always been concerned with equity and inclusion. And we have adjusted community health to kind of address some of the issues. If we look back to the riots of LA riots early, and it seems like there's events every year that impact communities even more and more. And you know, in the future, you know, coming up is the environment. What kind of issues the environment that's going to impact low-income communities, and how we need to address the need to address the infrastructure of these communities to make them more resilient. But just to give you an example from a community health, we started looking at the community, how we do community health needs assessment, how we do the implementation plans, how we look at cultural trauma as a mental health issue. But I'm going to go back to the community investment program, how we have, just to show how we have adjusted this program to fill the needs. I'll just go back to more recent times when we saw the real estate crisis hit in some of our areas, and low-income community individuals were losing their homes who had spent their lifetime trying to save and get a home ownership. What we decided to do is step up to the plate, and we worked with the housing provider there and said, look, we're going to provide you with a line of credit up to $1 million, and we need you to go to every bank and buy every property for 10 cents on the dollar you can get, so we can stabilize communities so these people can stay in their homes, because you can refinance those properties at a lower level. So we were able to stabilize some neighborhoods from individuals from losing their homes. And some individuals did lose their homes, but became renters, and there were other adjustments that we tried to make. When the pandemic, and I'm going to move a little bit closer to home, when the pandemic hit, we saw that food was becoming a major issue. And we saw those lines, and it was impressive to see individuals, whether they were driving a Mercedes or a truck or a beat up truck, how they stood in line for food. So we started looking at the production of food, and we found out that minority producers were having a difficult time accessing credit from traditional lenders, even to buy equipment. So we are looking at that area as a potential going forward of how do we invest in the production of food through to help minority farm owners. We're talking to the Black Coalition of Farmers. We're looking at California Forward and other organizations to see how we can develop a more stronger access to capital by minority farmers. So just to give you a couple of examples, I could give you more, but I don't want to take up time for David.
Yeah, so I'll just add to that briefly. I see my friend, Dr. Megan Sandell, on the line for Boston Medical Center, and I'll borrow a phrase from her colleague, Dr. Thea James, which is, how do we move from charity to equity? And I think at the heart of the Anchor Mission framework is just that we need to interrogate our current business practices and ask more about how those can be leveraged in service of addressing the deep-rooted inequities that concentrate in place. And I think the murder of George Floyd and so many injustices against communities of color really require us to go beyond current practice. And so when folks ask, why do we need to interrogate and think about leveraging our investments in geographically targeted ways, is because what we've been doing has been insufficient, and we need to bring more resources to bear in this effort. And not tapping into these long-term reserves is really, it continues that injustice. And so I think that is the lens that we should be applying when we ask these questions about what we can do here. And that's why in the Healthcare Anchor Network, we really say they should be geographically targeted, and you should have a thesis around who are you trying to reach with these dollars, not just any place within your community, but how are you really getting at the partnerships that allow you to reach low-income communities and communities of color. And I'll just give one example, because I see a couple of folks from Trinity Health on the line. We're just finishing up a case study on them, and as part of their community investment program around place-based investments, they are targeting their priority communities are communities with 40% or more Black or Latino residents, or communities with 40% or more residents living in poverty. And that really was an evolution from how their program had been structured historically. And so I think that type of change and that type of alignment is what was just further accelerated coming out of after the murder of George Floyd, and is really something we can't continue to not continue to move forward in the future.
Well, I truly hate to cut off this discussion because I think we could go on for hours. You've touched on many of the themes we'd hoped you would talk about today, the importance of partnership, coalition building, addressing the unmet needs. And perhaps we've got food for another webinar series, but now I want to turn it over to Maggie to wrap us up today. And thank you all for your incredible work in what you do day to day, which isn't easy. And we acknowledge that and we thank you. So Maggie, please.
Sure thing. Well, thank you so much, Tara, for facilitating today's really important conversation. And we are so grateful to each of our speakers, David Zuckerman, Dr. Alexander Garza, and Pablo Bravo, for sharing really valuable insights about the work that they do. A special thank you also goes to CIIC's Participation and Outreach Committee, which helped plan this webinar. And of course, if you are an impact investor that's already aligning your assets with your unique mission, please get in touch with CIIC. We'd be happy to share more details with you about our membership program or the Catholic Impact Investing Pledge. One last thing before we wrap up today, if you have 2 minutes now and want to share your feedback about this event and future CIIC events, there's going to be a feedback form that will pop up at the conclusion of the webinar. Shouldn't take more than 2 minutes to complete. Really wanted to thank everybody again for joining, all of our speakers, and wishing everyone a really wonderful Tuesday. Take care all.
Godspeed you all in your missions. Thank you.